Welcome to the exercise classroom. Today's lesson, the toe raise. Introduction. The toe raise, also known as the dorsiflexion exercise or tibialis anterior raise, is an isolation exercise that targets the anterior compartment of the lower leg, specifically the tibialis anterior. It is typically performed while standing or seated, raising the forefoot off the ground while keeping the heel planted. This exercise is particularly useful for balancing lower leg development, preventing shin splints, and improving ankle control. Although often overlooked, it plays a vital role in gait mechanics and injury prevention for runners and lifters alike. Body contour benefits. Toe raises help develop the front of the lower leg, particularly the shin area, which contributes to a more balanced and complete lower leg appearance. This is especially important for individuals seeking full 360-degree leg development and athletic aesthetics. The movement. The primary joint action is ankle dorsiflexion, where the top of the foot moves upward toward the shin. This is controlled by the tibialis anterior and supported by other anterior compartment muscles. Strengthening dorsiflexion improves gait mechanics, balance, and deceleration control. It plays a critical role in walking, sprinting, jumping, and directional changes, and helps prevent overuse injuries such as shin splints and anterior compartment tightness. Exercise execution. Stand upright with your feet flat on the ground or sit on a bench with your heels planted. You may also lean against a wall or use a band for resistance. Raise your toes and forefoot off the floor as high as possible while keeping your heels in contact with the ground. Contract the muscles along the front of your shins. Pause briefly at the top, then slowly lower the toes back to the floor under control, returning to the starting position. Proper technique. Perform the movement slowly and under control. Avoid swinging or using momentum to lift the toes. A full toe raise involves elevating the forefoot until the toes are clearly lifted off the ground, typically to a visible 30 to 45 degrees angle. Lowering them completely ensures a complete cycle of contraction and stretch. The most common mistake is using momentum or bouncing, which reduces activation of the tibialis anterior and shifts work to passive structures like tendons and joints. Muscle mechanics. The tibialis anterior contracts concentrically to lift the foot into dorsiflexion. At the top, an isometric hold can increase muscle awareness. The eccentric phase occurs during the controlled lowering of the forefoot. The extensor digitorum longus and extensor hallucis longus also assist with toe extension and ankle stabilization during the movement. Primary movers. The tibialis anterior is the primary muscle responsible for dorsiflexion. It originates on the lateral surface of the tibia and inserts into the medial cuneiform and first metatarsal bones. It plays a key role in lifting the foot during walking and stabilizing the ankle during the stance phase of gait. Other muscle roles. The gastrocnemius and soleus act as antagonists by resisting dorsiflexion and controlling plantar flexion. The extensor hallucis longus assists dorsiflexion and aids in toe extension. The extensor digitorum longus helps stabilize the foot during the lift and supports balance during standing variations. Biomechanical considerations. The foot should move through a clean dorsiflexion arc without inversion or eversion to maintain ankle alignment. Leaning against a wall or holding a stable surface helps reduce compensation and ensures isolated muscle activation. Bands or weighted dorsiflexion devices should apply resistance directly opposite to the lift to maintain effective loading. Controlling the eccentric phase maximizes muscle tension and reduces stress on connective tissue. Training effectiveness and optimization. Due to the endurance function of the tibialis anterior, reps in the 15 to 20 plus range are most effective. Holding the toes at peak dorsiflexion enhances recruitment and mind-muscle connection. Training each leg individually helps correct side-to-side imbalances and improves neuromuscular coordination. Rotating the toes slightly inward or outward can subtly shift emphasis on different portions of the calf musculature. Safety and injury prevention. Excessive volume can lead to anterior shin discomfort or aggravate pre-existing conditions like shin splints. Avoid jerking or rapid toe lifts, which can strain the tendons in the anterior compartment. Begin with bodyweight-only toe raises to master control before adding resistance. Perform on a flat, stable surface with supportive shoes to reduce the risk of slipping or compensation. Variations and alternatives. Resistance band dorsiflexion. Provides variable resistance and allows seated or supine training for isolated control. Seated machine dorsiflexion. When available, this gym-based option targets the tibialis anterior with direct, isolated resistance. Seated bodyweight ankle dorsiflexion. A simple, accessible option performed while seated, lifting the forefoot repeatedly without added resistance to build endurance and motor control. Learning the toe raise deepens your understanding of dorsiflexion mechanics and equips you to strengthen an often neglected muscle essential for foot control, balance, and injury prevention.